Welcome to the Healers Café, conversations on health and healing with Manon Bolliger, a retired and deregistered naturopathic physician with 30 plus years of experience. Here you will discover engaging and informative conversations between experienced healers, covering all aspects of healing, the personal journey, the journey of the practitioner, and the amazing possibilities for our own body and spirit.
So welcome to the Healers Café. And today I have with me Dr. Parvin Zarrin, and she's the founder of several clinics, the Integrative Medicine and Nutrition, the founder of Homeopathy and Nutrition Clinic, and also BioQuantum Academy in Canada. And she had her PhD program, was awarded excellence for her achievements. And well, okay, lots and lots of information. We've been on several conferences together, and she's an absolute pleasure and wealth of information. So I'm really excited to have her here today. So welcome, Parvin.
Thank you. Thank you so much.
So I start with the same question for everyone, because people who come to listen to these conversations are always curious about how did you step into what you stepped into? How did you go into these healing arts? And so I think if you start a little bit with that, that would be fantastic.
How did I come in? Hold on a second, please. Just let me get back here. Yeah, I have you right here. How did I come to be a homeopath, to be a nutritionist?
Yeah, exactly, the beginning.
The beginning. So first of all, I would like to say that I'm not a healer. So we are nature's assistant. We are practically, I don't call myself healer, but I try to help people to heal themselves. So I have a lot of stories to talk about. Why did I come to nutrition? Why did I come to homeopathy? It's going to take hours if I want to talk about it. How, I don't know, universe brought me, to this. It was a calling or something. I don't know. But I think my healing journey maybe started from my childhood. What I remember, as well, my recollection allows me to, talk about it. I was a very sick child. I can say I was a very sick child. We were 6 siblings. I think, the only child that I was almost encounter all the childhood diseases. I was suffering from very severe, life-threatening, for example, anemia. I was having asthmatic attacks. I was having recurrent infections. I was having rheumatism. I was in deathbed 2 times, as I remember. But actually, what I'm talking about now, I was talking to my kids last night. That's why I remember what I told them. So I was like bedridden for almost maybe 8 months. I went through anaphylactic shock. They gave me antibiotics after antibiotics, and I was not responding to allopathic medications back then, not whatsoever. I remember that maybe 20 different kind of medication was administered. I was in hospitals. I remember exactly when the doctor was talking to my mother, and my parents were beside my bed. I was just maybe 8 years old. I exactly remember the conversation that the doctor told my mother, you gotta take this girl home. She's not gonna last. She's not gonna survive. And, because it was a combination, a mix of so many different kind of, back then they call it diseases, which they were not. It was just one disease with a lot of different manifestations. But anyways, to make my story short, definitely parents don't want to give up their children, definitely. So it was heartbreaking for my mother. I remember exactly how much she was crying that when they told her that this girl is not going to last. So I remember that they hold me, my father held me and brought me home. I couldn't walk because I was completely, paralyzed. And so I remember about the conversation and people coming, going in my house and everything. My parents, my mother did not give up. So she was calling a lot of herbalists. She was calling a lot of people, to come and see maybe they have any solutions or answers or whatever. I remember a lot of techniques were applied to me, a lot of herbal things, a lot of things that they're asking me to take. But there is something that it was inspiring to me. It was a philosopher. It was like a ancient philosopher, Persian philosopher, is called Avicenna. I think sometimes I talk about it, and I have it in my book, actually. I talked about it in my book. I remember, I don't know if my mother borrowed it or bought it or something. The book was called Cure.
Yeah.
The book was called Cure, and that book actually, the principles of that philosopher's treatments for patients was like cures like. Exactly based on the homeopathic principles. Right. So my mother was not a homeopath. My mother didn't know homeopathy, but she, I think, precisely followed. It was a lot of nutritional facts, a lot of nutritional recipes, holistic, and a lot of herbals and everything. So as I remember, she was following it precisely, and she was telling me, listen, I want you to live. You got to take this. I want you to live. So anyways, that took, I think, a year or a year and a half. I was completely recovered. I was completely recovered from almost all the so-called diseases, and all the symptoms were gone, and I started growing. My growth was stopped. I started growing and growing and growing, and I became a beautiful girl. And then my mother took me to the same doctor, and she told him, "It's the same girl that you said she's not going to last."
Wow.
And that allopath, the medical doctor, said, "I think I have to change my job." I said, and now I am saying that all of them, they have to change their jobs.
It's funny with what you say too. I also practice homeopathy as a naturopath, but my specialty. Oh, we're not even allowed to say specialty either.
Yes.
Anyway, but we can never use the word cure, which is quite funny.
Exactly. So, but that book was called Cure. It's still, but anyways, because we don't cure we don't cure you cure yourself. That's why we're just nature's assistant to help you. We give you tools, the tools and remedies in order to heal. That healing principles is within you. So that's why we don't call it cure. So, because cure, as I said, cure is an internal domain of each individual. So that may be subconsciously sitting somewhere there. But again, I was admitted to university when I, after high school to engineering program. And because of my faith or religion, whatever, I was expelled from university. So they told me you cannot come to university. So, and because, it was a religious, a revolution happened back home, and whoever were not in the same religion, they were not allowed to continue their educations. And as I said, I was admitted in engineering program, but after 8 years of being expelled from university, they told me you can come back. You can come back, but you're not allowed to be an engineer because women cannot be an engineer. So back then, they only gave me choices to go to either biology or chemistry or nutrition. So I chose to go to nutrition, but anyways, I came to Canada afterwards and I continued my education here. I became nutritionist, but that nutrition was nutritional sciences and was very clinical. And it was not satisfying for me somehow. I just wanted something holistic. You know, again, I went back to to my childhood, the way that I remember my mother was, you know, was treating me with holistic nutrition. So I started, you know, learning things on my own. Maybe that was that ignite to bring me, you know, mostly into holistic fields. But the main thing that brought me into homeopathy was my postpartum depression after my third child. So it was very debilitating. It was very paralyzing, and I was not responding to allopathic medication whatsoever. And I was experiencing a lot of adverse effects. Somehow, for some reasons, I was not kind of responding to allopathic medications, and I was practically refusing to take, you know, refusing to take. And then, so somehow I came to cure myself, to heal myself, again, to find a solution through something holistic. So I found homeopathy, homeopathic remedies. The only thing I went to a nutritionist actually, and she said, I think if you go with, I give you some homeopathic remedies. Back then in Canada, homeopathy was not, you know, everybody could, you know, prescribe it, and is now as well, you know. But I mean, a nutritionist told me, I said, what is homeopathy? She said, it's based on like cures like. I said, oh, it's based on like vaccination. She said, yes. So anyways, I started taking some remedies, and I got better and better and better. And definitely I did not, you know, continue the allopathic medications. And then after that, I decided to go to homeopathic school. I said, I think this is time, because I went to get my master's for nutrition, was not satisfying. I didn't want to, honestly, somehow the whole settings and the whole healthcare system was not resonating with me. So maybe that was another ignite to just take me to homeopathic school. The very first, you know, I found it in a Vitality magazine. I don't know if you know about that. The Vitality magazine. The very first school I saw, maybe on the second page, was Homeopathic College of Canada, and I said, wow, there is a college in Toronto, so it's just 20 minutes apart from the distance from my house. What is going on here? So I just called the college, and they answered the phone. Tomorrow, it just in 24 hours, I registered. And it was the best 4 years of my life, and the most challenging years of my life, because coming from clinical background into holistic, completely opposite, because what you learn, it's the training, even in nutritional sciences, the training is more towards allopathic, you know, a model. And imagine coming from, you know, into homeopathy, which is completely different world. It's a different world. You know, I remember the very first week I started crying and say, but remedies helped me. But the philosophy and everything, you know, behind this modality, it was very, very hard to understand and learn. And, you know, but at the end of the day, you know, I mastered it and I got the honor, and, you know, and
let me stop you there for a second, because what is it that you found? Because obviously you had experience, so you knew that it could work. What is the resistance that you actually experienced, and in which way do you find that it was different than, you know, clinical nutrition, which is based more allopathic model? Like, can you explain a little bit what that is? Because I think
yes,
that would be really interesting to, you know, because it's like, it's hard to convince people, except when they're desperate and they've tried everything. Then people try just about anything, including homeopathy, you know, but you already knew it worked. So what is that resistance? What is it that was difficult in your experience?
The difficulty to understand, because for example, the allopathic model that, it's a mainstream, and that's how their system of medicine works. That is anti something, antibiotic, antiviral, anti-inflammatory, anti this, anti that, and from that kind of perspective, you're coming to like cures like, means similar. You have to give a medicine that is completely similar to your disease, completely similar to the totality of symptoms. That's a very challenging to understand how similarity works, and then when you understand then I completely understood the fundamental aspect of it, that the concept of similarities. Then I said, okay, this is based on vaccination, the immunization that is, then again, it's like a flashback to my childhood, that, that book was talking about it. But the challenge to understand it profoundly was, coming from anti something, anti, symptoms, suppressing anti-symptoms, coming to similarities. And it was challenging to adapt, and then that adaptation period was very challenging for me. And that's great that I was not an MD, for MD was much more challenging. But as soon as I understood fundamentally and fundamental aspects of these principles and the concept of cure by this system of medicine, then everything became easy for me. So yes,
that's no, it's a very interesting point, because we're still dealing with that general schism of philosophy,
yes,
on whether we fight from the outside, we attack. It's the same we do in war. It's the same it's the same philosophy, right? Or do you work with the inside, of the person, and you present something that your immune system, or your vital force reacts to, and you trust the innate healing capacity. Manon Bolliger here, and I want to thank you for taking actionable steps towards engaging your healing journey and helping others discover their path by watching, sharing, subscribing, and reviewing these podcasts. Every review and share helps spread the word, these different perspectives and choices and options for healing. And to thank you, I'd like to invite you to sign up to my free 7-sequence email tips on health and healing for everyday life. You can go to healerscafe.com tips. Thanks so much.
absolutely.
I don't mean trust blindly. You observe, you take notes. I mean, for homeopaths have had many physicians come to observe the detail of their interview process, because it's one of the most detailed. I know Harvard University used to send its medical doctors to observe the depth of case taking of homeopathy, because we ask questions that that for typical medicine they don't need to know, because their primary function is to match a drug to a symptom.
Exactly.
That's it, right? So they're not looking at healing. They're not looking at the possibility to cure. It's really management of symptoms, and that's such a different way of looking at,
Yes. As I said, there are two completely opposite perspectives.
Yeah.
They call diabetes a disease, they call depression a disease, they call high blood pressure a disease, they call this. Human being has only one disease with countless manifestations of disease.
Yes.
The way that I had it in my childhood is only one disease, one disharmony, one chaos internally that has to be addressed that underlying causes should be addressed, should be found. Then the manifestations, which are the symptoms, and they call them disease, going to be removed on their own. You don't have to make any efforts to remove those manifestations. You just have to go within by healing, because we all are born, we all as human beings and all living beings are born with this power, with this ability to heal ourselves. We can fix this ourselves. Our wisdom, our intelligence knows how to fix itself, when to fix itself, as long as we give them the raw materials the body needs, we give them the right tools, then the body's intelligence and wisdom knows how to do it on itself. That's why we don't call ourselves healers, because the healing principle, healing power is within you, within us. So that is completely ignored and is missed in allopathic model. So that's a challenge for example, medical doctors when they come to homeopathy. They think by external thing, giving external like medication, you can heal the person. There is no way. Human beings has the biggest factory and manufacturers of medicine and remedies within. So the only thing you have to just activate it. You have to just support it. Then that healing power will surface and would cure the person on its own. So that's a challenge that there's a lot of medical backgrounds, no matter what, they have to go through homeopathy. That's why we had a lot of dropped out, and a lot of, I stayed to the end, and now I am the biggest advocate for it, because it's just true science. It's just true science,
Well, it really is, when you think, how they prove the remedies, even the whole process, taking down every symptom that it can produce, and then matching, like you said, the similarity of the symptoms that we produce when we're not in tune, right? So it is so scientific, actually.
That's the true science. That's the true science. That the other one is the false science and fake narratives. To me, true science is you can find it in homeopathy and all the holistic modalities that they can help the person to heal. So
yeah, let me ask you this, because I see BioQuantum Academy. I wanted a chance a little bit to what then happened. What is BioQuantum? Continue with your evolution.
Okay, my evolution started from my nutrition background. I was a nutritionist for a decade. Then I went to homeopathic school and I graduated. I established homeopathy clinic, then established integrative medicine a decade after. And that's another story behind it. I don't want to take up your time, but there is always the reason that I did it. So I was one of the pioneers and frontliners of the homeopathic regulations. That's what I thought back then is going to be something nationwide, but it didn't happen. It just happened in one province out of 13 provinces. And I am a Canadian practitioner. It means that I work nationwide and I also work internationally. So it doesn't make sense to me to just one state among 10 provinces and 3 territories, only one state has regulations. That doesn't, and plus, what we fought for, it was to get into the healthcare system, which they did not allow us again. And also, even back then, we had insurance. Then after regulation, they cut off the insurance. So it just doesn't make sense to me, it was a challenge, one of the challenges that I faced. Then I established integrative medicine because I wanted to have the umbrella for almost everything underneath. And then when you get to the point that you think that we never have enough knowledge. That's the pool of knowledge is a ocean of knowledge. You know, we are just I personally a drop of that ocean, but to a point at the physical, you know, dimension, you see that you have enough knowledge to pass it to the others. And plus homeopathy is being suppressed, oppressed, and it's been attacked. It's been dominated, you know, it's been looked down a little, and a lot of things happen. So I just wanted to diffuse it. I just wanted to teach it, you know, to medical practitioners. And then I established my institution. So that was the plan to do it 2015. Then took me so time, you know, and to establish it. So by 2017, I established it, and then I started running it by 2018. So now the Bioquantum Academy went much further than what I dreamt, you know, and now is a partner of Global Scientific Guild. We are, I'm the partner of conference now is at the global level. So, and this is something that I always wanted to bring it to practitioners mostly, because for the public, you know, I have mass education for the public on media, and you know, I always try to educate people. You know, this is something that comes from my heart. But when it comes to practitioner, I always wanted to create something, because it's very hard to teach practitioners. It's very hard to educate practitioners. You know, I think the best happened to me is just to partner with the conference. Now, as you see, Dr. Manon, they're all like you. They're top experts. All of you guys are top doctors, top scientists joining our conference, and this is something that I always you know, dream about, that we can bring this. And as you know, that I always talk about this modality, and now a lot of, you know, doctors practically who are joining our conferences are all like-minded, you know, people like us.
I think it's the time, you know, also, I mean, because for me, my practice has been like 30 years. Wow. Until I got well, I chose to deregulate.
I love that word. I love that, deregulated or deregistered. I really love that.
Yeah. I got suspended, you know, for sharing information during the so-called pandemic. Yeah. That would be helpful to people. But deregistered was actually my choice. When, you know, when an association or a body no longer, when it keeps you small and you know you're no longer in integrity because they're willing to follow rules that are not based on science. And I actually think science is important. You know, real science, not the science.
True science, yes.
True science, you know, the how it works, right? Like it's really important to me. And also, you know, allowing people to heal and being super informed, you know, going like questioning, having an open mind and going, you know, I don't know here. I wonder what else, you know, that type of spirit. And I found that very much the case in the group. What is it called again? The convention that we're part of?
Global Scientific Guild.
Yeah, Global Scientific Guild. Sorry, my memory for names is small, but I have absolutely loved participating in that, because like you say, it brings people in different backgrounds, but that are open. And I think that's the key here, because we're in a time where it's obvious that the old paradigm has major limitations. So many people are frustrated, And doctors are frustrated. They feel like they're drug peddlers, you know.
I know, they become like agents, like sales agents.
Exactly, exactly.
And they don't feel good about it.
They don't, they know, exactly. You know, I
See?
had many doctors in my clinic, and I was like, they say, you're so lucky, you know, that you can actually help people. And
Of course, You know, Dr. Manon, the world is in chaos. For the past 100 years, the medicine is being monopolized,
yes,
you know, by big pharma, and also been applied and carried out by mainstream medicine. And there was no, you know, kind of situation, the right situation for our modalities. But I decided, you know, we all are like-minded. We all are kind of working so hard towards the goal. But honestly, the world needs heroes now. The world needs heroes because to fight the philosophians, to fight their fake narratives.
yeah,
And these heroes, you can find them across the globe. And I can see them in the conference.
yeah,
I can see them in the conference. And the world needs these people.
yeah.
And we have to unite. We have to be united. Because one person, yes, you are doing so much. I am doing so much. And definitely we're helping people, but the world needs to be saved. That's why I am collaborating globally with colleges, with all institutions, and I want to bring this, you know, integrative modalities, natural modalities to all, you know, different countries, because, for example, homeopathy has been so dominated. At this point, even though it's been suppressed, oppressed, and dominated, but it's still the second largest medicine in the world.
Yeah.
But definitely it would be first if the medicine was not monopolized by the mainstream. So what I'm trying to say is I want to bring all medical practitioners, because Dr. Manon, even medical doctor, we are not having anything against medical doctors.
No.
What we are against is the model.
Yeah.
The model, the trainings. But whoever comes to medicine wants to save lives.
Yeah.
And we can see the medical doctors, what they're, you know, they're sacrificing their time, everything in emergency rooms, for example.
Yeah.
But when it comes to chronic diseases, they have no solution for it.
No.
They have no solution, but actually they mess up the system, they mess up people's body, but the trainings does not tell them what to do. So that's my purpose, is to bring all this to whoever has compassion for helping people to heal. So, and we leave out whoever.
Exactly. No, I agree. That's very much the same way I see the world, and it's I think it's come to a climax now.
Yes.
That not only are people like ourselves and people that are like in that group are so needed, but people are starting to feel desperate because they're seeing that the solutions are limited. And, you know, rather than create a new division and a new war, which is the part of the old narrative, it's like, no, we should join together, put the best of our bests, get rid of what doesn't work, you know, and allow for real choice, you know. So anyway, listen, our time is up. Last words, please. Anything else you want to share?
Oh, thank you so much, Dr. Manon. It was amazing. I was so excited to join you today, and it was such a great pleasure to meet you at the conference. And now we're working together. Hopefully our institutions also can come together and come up with a platform that that's the only way, Dr. Manon, that we can help people, especially practitioners who are open-minded, who are like-minded, and who wants to find a solution for this, and let's save the world. let's save the world, because people lost trust. People have lost trust in mainstream and politics. So let's be just people's practitioners and come together and unite and just go forward.
Thank you.
Thank you so much.
Thank you for joining us at the Healers Café with Manon Bolliger. Continue your healing journey by visiting thehealerscafe.com and her website, and discover how to listen to your body and reboot for optimal health.